Good afternoon, everyone, once again. And thank you for joining us today for today's live session with Dr. Gayatri. Today's session is going to be on COVID awareness. We're going to hear about what COVID is directly from a doctor who's experienced it firsthand, who's seen cases firsthand. Before we begin, I'd like to invite Ms. Jennifer Andrews to invoke God's blessings.
Let us join our hands and quieten ourselves in the presence of God. Thank you for blessing us today with a wonderful opportunity to meet virtually and learn together in the awesomely exciting webinar. May we humbly commit every part of this webinar to you as we all bring you glory, honor, and praise for your kingdom and holy name. May your blessings of wisdom and guidance be upon us all through the sharing and impartation of knowledge and skills by our organizer, Principal Reverend Father Rohin D. Almeida, our resource speaker, Dr. Gayatri Shashi Kumar. May all of us learn together the awareness of COVID so that we upgrade our competencies and capacitate us to help in the development of our learners' lives and communities in the spirit of your love and generosity. We ask all this in your precious name. Amen.
Thank you, Jennifer, for invoking God's blessings. Before we ask Dr. Gayatri to take over, I'd like to just give you all a few instructions. If you have any questions that you would like to ask us or ask the doctor during the session, there is a chat box. Students, you all are aware of how this works. Just type out your question and I will be reading it out to Dr. Gayatri by the end of her presentation. I'd also like to thank Dr. Gayatri. Today is a day that she is actually on duty and she's taken some time out to be with us. So, Doctor, thank you so much. I'm just going to introduce Doctor to us today. Dr. Gayatri Shashi Kumar is an assistant professor in the Department of Anesthesiology at Ramaya Medical College and Hospitals, Bangalore. She is from Kerala and has completed her MBBS and her PG in the Government Medical College, Trivandrum. She did her DNB anesthesia from the Regional Cancer Center Trivandrum and completed her fellowship in pediatric anesthesia from the BC Children's Hospital, Vancouver, Canada. She also worked for 2 years in the Regional Cancer Center Trivandrum after she got back from her fellowship. Currently, Dr. Gayatri is working in Ramaya Hospitals since 2016. She is also an active Rotarian and is the secretary of her club Rotary RMV Central. And through her role in Rotary and being a doctor who comes in contact with COVID patients at her workplace, she's been actively involved in promoting awareness about COVID in the community. Dr. Gayatri, thank you so much and over to you.
Thank you, Sheila, for the kind introduction. And a very good afternoon to all you Josephites. I really wish we were at a platform that I could see all of you all, but I'm forced to stare at myself and at my PowerPoint presentation, which I've been very much doing the same thing for the past couple of days as I've been preparing for this talk. I'm really excited today to be doing this talk with you in the afternoon. I hope I don't put you off to sleep because it's a post-lunch session, but it's really exciting because I have an audience that I believe is very influential, right? Because I believe students, kids in general, can influence. Can you all hear me?
Yes.
Yeah.
Yes.
So kids and students in general are very influential, and I believe you can change the practice of the society and the way society thinks. So I want to share whatever little experience I've had working with COVID patients. Like Sheila ma'am pointed out, I'm an anesthesiologist. I'm somebody who puts people to sleep when they come in for surgery so that you don't know the pain during the operation. And other than for this, one of the few other things that I do is take care of seriously ill patients in the intensive care unit or the ICU of a hospital. So ever since my hospital, the hospital that I worked in, started admitting patients who are COVID positive from around the month of May, we've been constantly coming in contact with patients either under anesthesia or in the critical care setting. And after seeing them suffer, some of them having very severe COVID related issues, I've actively tried to propagate what we can do to keep this infection from spreading and somehow work towards banishing this virus from our lives, right? Because it's been a year. We've been running from this virus. We've been sitting at home. We've been locked up. We've lost all normalcy from our lives. And we've come to a point where I think it's really tiring, including me. I'm really tired, right? Of wearing all my PPE and all the equipments that I have to wear when I go to work. So I think it's high time we take things in our hands and do something about it. Like Sheila ma'am pointed out, if there is anything that you need to ask me during this talk, if I'm going too fast for you, if I'm using words that you're not familiar with, which you want me to elaborate on, please feel free to write on your chat boxes, and then I can sort it out later and I can clear those. I'll try and clear out whatever doubts you have at the end of this talk. So before we move forward, we'll just take a quick recap as to how this all started. I think we all are very familiar with what how it started. So there was a small little city in Wuhan called Wuhan in China, where a lot of people started falling sick at the same time. And they had, cough, fever, and respiratory system related illness, the system which helps in us breathing, right? Illness. Leading to infection of the lungs, which we call pneumonia, and a lot of these people ended up dying. So when there were a lot of people in the same community getting infected with what seemed to be the same kind of organism, the doctors and the scientists sat up to take notice, and they thought, let's find out what is the organism that is causing this, right? And they figured that it is a virus called the coronavirus, aptly called so because of the appearance of a crown, and hence it's called a coronavirus. And this virus, though was present in our community even before, causing minor illnesses like the common cold, this particular strain of coronavirus was a new strain which was causing new symptoms in patients which were earlier not seen, and hence we called it the novel coronavirus, right? And from China, slowly the infection started spreading off to different countries across continents, and that is why the WHO, or the World Health Organization, labeled this a pandemic. Right? Now, what is a pandemic? So when Corona started off, when it first came to India somewhere in the month of February, there was a lot of media, and there is still a lot of media attention, but I think there was a lot of media hype on it. I wouldn't say hype, but there was a lot of scare created by the media saying that whoever gets it is going to die, and everyone was really scared. And the word pandemic somehow came to be associated with death. Right? A pandemic simply means a disease that spreads across continents. It is not necessary that everyone who gets the disease is going to end up dying. Okay, so this is the picture. So to show you that what the reality is why I have this picture. For the older classes, those who are familiar with the pie chart, I think you'll understand what I've shown here. But for the younger ones, who I was told that they are kids from 4th standard onwards, for you people to really understand that picture, just think of it as a giant pizza which has got 3 different colors. So one is green, one is blue, and the small little piece over there is yellow, which nobody wants, right? We always want the giant piece of the pizza. Right, so let me explain this diagram to you. So today, if I have 100 patients who turn out to be COVID positive, okay, we have 100 patients who turn out to be COVID positive. Of these 100 patients, 80 of them, so the huge giant slice in the pizza, which represents the number 80 of these patients will be usually asymptomatic, meaning they do not have any symptoms. So there is no fever, no cold, no headache, nothing. We'll talk about the symptoms of COVID later in the later slide, but they won't have any symptoms, or they may be mildly symptomatic. Maybe, a small fever, a mild cough, a little runny nose, maybe a feeling of being tired, but nothing much to worry, right? So 100 minus 80 is 20. Okay, don't worry, this is not a math class. This is the only piece of math that I'll be talking to you about today. So 100 minus 80 is 20. So we have 20 other patients left. Of the 20 patients left, 15 patients, which is shown by the blue piece of the pizza, will have severe form of the COVID, severe symptoms of COVID, who will need to be admitted in the hospital so that they get oxygen, right? And they also get injections, medicines through an injection on their hand, okay? And 5 people out of those 20 will have very severe illness, so severe that they will not be able to breathe by themselves, and so they'll have to be connected to a machine we call the ventilator, which will help them breathe. And they'll have to be admitted in the ICU and stay in the hospital for as long as sometimes a month or more, okay? So the good thing is that today's audience, all of you students, are going to come in this large slice of pizza, right? You are going to fall in the group of 80, where you're going to be mostly asymptomatic or mild if you happen to get COVID positive. Okay, because we are in a pandemic, we cannot say that, oh, I'm never going to get it. Someday or the other, most of us are going to get infected, right? So our effort is to try and prevent that, but in spite of our best efforts, sometimes we might end up getting positive, in which case most of you are going to be in the asymptomatic category. So you're going to get the largest slice of the pizza, right? So when you see that, whenever you get the best of anything, we automatically have a sense of power, right? Oh, I'm going to get the best of it, so nothing is going to touch me. So even if I get COVID positive, even if the virus infects my body, I'm going to be asymptomatic or mildly symptomatic. Nothing is going to happen to me. Is what, you know, a lot of people interpret this diagram as, okay? So there's a lot of sense of, you know, power in that knowledge. But this is a very, you know, a quote from Spider-Man that I really like quoting it to myself also a couple of times, is that with great power comes great responsibility. All right, you have the power, yes, because you're young, you're healthy, so you're probably going to be asymptomatic or only mildly symptomatic, so it's not really probably going to affect you in the way it's going to affect the older people like your grandparents or your parents. But the fact that you fall in the green is very important, because you are going to be something called the asymptomatic carriers. Okay, now what is an asymptomatic carrier? We've all heard about tiffin carriers. These tiffin carriers are something that carry our tiffin, right? So the same way, asymptomatic carriers of the disease are people who have the virus inside them. So I am COVID positive, but I do not have any symptoms. So I'm an asymptomatic carrier. So why am I at risk to everybody? Because I have the virus, but I do not know that I have the virus because I have no symptoms at all. And if now I go out to the community, I play with my friends, or I play with my, you know, go and meet my grandparents or my, you know, parents and their friends, or party with somebody, I'm going to unknowingly transmit this virus to all of them. And many of these elderly people or the older adults are not going to be as lucky as I am. Okay, they are not going to get the giant slice of pizza. They are going to get those small sizes of pizza, which is not a fun thing to be in, right? So that is the reason why it is very important to know that it is not about, you know, just you being safe. It's in a pandemic, you also need to see that you need to keep your loved ones safe, right? So how do we do that? So it's been a year, right? It started in China in December, and now we are in we're in November now. So it's almost going to be a year since Corona has come into our lives. Okay, and over the past year, like in the newspaper, you have articles about whatever is happening new in the field of sports, in the field of politics, in the field of medicine. To know what's happening new, we have publication called the journal. Right? So in all the journal publications, we've had so many people coming up with several medicines saying, oh, this one is good, that one is not good. So sometimes some medicines are good for a set number of people, and the same medicine may not act for another set of people. So we've really, frankly, not got a medicine which is, you know, 100% effective in all the people who turn positive COVID. All right. So what is the best medicine? So the only thing that has been proven to be the best medicine in COVID is prevention. All right. So prevention is the best medicine. So we try and prevent as far as possible from getting this illness. So how do we go about that? So it's a very easy thing. You really look at it, it's very easy. You need to follow only 3 things. One is social distancing. Second is hand washing. Third is wearing a mask. All right. Now, before we go into why this helps in preventing the disease, let's see how the coronavirus is spread. I'm sure you've heard all of this again, several times over the past year, but I just want to emphasize on this, giving reason as to why we stress on the 3 norms for preventive measures in COVID. Right? So one is droplet or aerosol spread. Second is airborne transmission. Third is surface transmission or fomite spread. So I'll just go to the next slide to show you what happens. Right? So now this man here in the figure is a COVID positive patient who has cough and is coughing out. And when you see when he coughs out, there are small little red dots and large little large dots, which are actually coming out of the mouth. These are his saliva and secretions, which carry the infected viral particles, because the coronavirus is a respiratory virus, I said. It resides in our respiratory system. So it's there in our nose, it's there in our mouth and throats. So when we cough, the secretions along with the active viral particle, infective viral particles come out into the air around us. And if somebody is standing very close to me and if I happen to cough without covering my mouth or without having a mask over my face, whatever I'm coughing out, all the viral particles are going to enter into his or her respiratory system and infect them as well. All right. And that is the reason why we say we should have social distancing. Okay. The second thing we talked about was airborne transmission. Now this one is aerosol transmission. The first one that I talked about is aerosol transmission. The second one is airborne transmission. Now these particles that release from our mouth get suspended. They stay in the air around us for some time, and they may be carried for a certain amount of distance by the wind or air around us. And if a person is even standing a little away from us, also can get infected with this viral particles. And hence it is pertinent that you should wear a mask. Both the patient who is infected and the person who is interacting with that person or person whom you're meeting should also be wearing a mask, so that you can protect each other from spreading the infection. If you notice, there is a small arrow which goes down, which falls. It says exhalation and it goes down. So a few particles that the patient coughs out, if they're very heavy, they fall down on surfaces, tables or chairs or anything that you are standing next to. And this is what comprises of the fomite spread. All right, or surface transmission. And if you were to accidentally touch a surface which has infected viral particles from a COVID positive patient, and you happen to touch your face, eyes, nose or mouth with your infected hand, then you are at risk of getting the infection from such a surface. Now there's been a lot of debate as to how many hours the virus is going to be present in in glass it's going to be present for so many hours, in cardboard it's going to be present in so many hours. I don't really think we need to go into that as such. Just know that these surfaces are dangerous, and it is dangerous to touch surfaces when you go out. So whenever you've known that you've touched something, make sure that you wash your hands with a sanitizer or with soap and water once you come back home. Right, so just looking at what are the 3 things that we need to do once again. So keep your distance. We've heard in school assemblies, it's always about 1 arm distance, but the new norm now is keep 6 feet distance, right? So you stay as far away from the person from each other, avoid going to crowded places. And if you happen to go to crowded places, make sure that you are wearing a mask, and wear a mask even otherwise when you go out, right? The next thing is wash your hands. Now wash your hands to the happy birthday song I've written. What is the relationship between washing hands and happy birthday song? For those of you who watch TV and are familiar with the advertisement of Lifebuoy, if you remember, there was an advertisement where these kids go for a camp and there's this little fat boy, cute little fat boy who comes and he's using a bar of soap and rubbing and rubbing and rubbing his hand. And there's this little girl who comes up smartly, watches him for some time, comes up smartly to him and says, "Oh, tumhara sabun to bahut slow hai." And then life boy would say, you know, in 3 seconds or in under 10 seconds, we are going to remove all the germs in your hand. But the same life boy now shows an advertisement which says you have to wash your hand for 20 seconds because it has been proven that to get the virus, the infected viral, particles off your hand, you should wash your hand for 20 seconds. And when you sing the happy birthday song for 2 times, then it approximately takes about 20 seconds. Actually, it takes a little more than 20 seconds, but definitely you cannot finish singing the happy birthday song before 20 seconds unless you're like really going on hyper speed mode. So if you sing the birthday song for in 2 rounds of the happy birthday song, that amounts to about 20 seconds. So either you use soap and water to wash your hands for 20 seconds, or you use a sanitizer which should have about 60% of alcohol at least, and that also you need to rub for 20 seconds, and you allow your hands to dry after using the sanitizer. Do not wipe your hands with a towel or anything. Use a sanitizer, rub your hands for 20 seconds, and then keep your hands up so that they dry naturally. All right. Now, I've talked to you about the preventive steps, right? But remember that we are in a pandemic. All right. So everywhere around us, we have the virus. The virus is everywhere waiting for getting into our respiratory tracts. All right. So in spite of taking all these preventive measures, sometimes we may be caught off guard, right? For example, a point where I would be caught off guard, like the moment I leave home now to go for duty, I would be wearing my mask, I'll wear a head shield, I would be, very cautious about what I'm doing because I'm going to be working with patients who could be COVID positives or COVID suspects. So the one part where I would knowingly get my guard down is when I try to eat my meal, right? Obviously, I cannot eat it through the mask. So I'll have to get my mask down to eat my, get my food into my mouth. And that is one area where I would be knowingly letting my guard down. And if at that point I come in contact with somebody who is positive and happens to share a meal with me and who could be an asymptomatic carrier, like we said before, he or she doesn't know that they carry the virus, then I'm at risk of getting the viral infection from them. All right. So in spite of our best measures, we might get infected with the COVID. So it is very important to know that, you may have tried your best, but you might still get the virus, and it is not something to be ashamed of. You should never be ashamed of. It's not because of anything that you have done wrong. Right? We're just in a pandemic situation. This is completely new to us. Not touching the face, wearing a mask, keeping distances from each other. These are all things that we are learning. I'm 40 years old. For the past, 39 years, I've been, spending time with my friends, not wearing a mask when I'm going out, touching my face when my eyes are itching or my nose is itching. And suddenly in the past 1 year, I've been forced to unlearn whatever I've been doing. It's really difficult, right? So there is nothing to be ashamed of if you turn COVID positive. And I really hope that nobody is actually like, I've unfortunately seen a lot of people telling that, oh, this so-and-so person became COVID positive. You know what, he's been really careless. I don't think we should be judgmental also. We shouldn't be thinking, oh, he or she got COVID because he's, being careless, because I don't think anybody, genuinely wants to get this, right? So nobody is trying to remove all this and say, oh, I don't want it. Yes, there's a false sense of security after seeing that large pizza that I showed you, because some people feel that, oh, nothing is going to happen to me, so they might become a little careless. But even then, if they become careless, I think it's okay, right? So what are the symptoms that you might get when you have COVID? We all are familiar with the symptoms. So we may have fever, we may have a cough, sore throat, fatigue, or we may feel very tired. Sometimes, there may not be any fever. Patients may have only, body ache or a headache or a runny or a blocked nose. and sometimes people will present with difficulty in breathing. Sometimes there won't be anything related to the respiratory system. There is no cough, no runny nose, no fever. Patients might still simply present with vomiting or loose motion, right? Another interesting symptom that has been known to be associated with COVID in particular is a new loss of taste or smell. So I've had a lot of my students and colleagues who've had COVID and who've had loss of taste and smell. Sometimes this lasts for about 2 to 3 days, maybe and may last to up to more than 3 weeks also, but slowly the smell and taste does come back. So there's nothing that we should really worry about. Now, before I go further, I would want to clarify the term quarantine and isolation. Isolation is the term used if you are COVID positive, you've been diagnosed COVID positive, you know that you have an infection, then you need to stay in a room isolated from everybody, away from everyone, so that you do not spread that infection to others. And you do not leave your house except for medical treatment, except when you're going to the hospital. The word quarantine, on the other hand, is used for somebody who has come in contact with a COVID positive patient. So if, for example, me, when I worked in the ICU, I was posted for 1 week in the COVID ICU. So I was away from home. I was 24/7 on call in the COVID ICU. And when I was there for 7 days, I was in contact with COVID positive patients, though I was wearing all the protective gear that we wear. When I came back home at the end of those 7 days, I was in quarantine because I had come in contact with somebody who was COVID positive, but at present I do not have any symptoms, nor have I tested positive. So I stayed at home for a period of 7 days. That's the rule in my hospital. So we stayed at home for 7 days. At the end of the 7th day, I got tested. And when I found that I was negative, I started working after the 10th day. So ideally, if you're not getting tested, you're supposed to be in quarantine for 14 days till you develop symptoms. Why do we sit in quarantine for 14 days? Because that is the incubation period of the virus. What is an incubation period? For any organism that infects humans or infects any living organism, from the time that the organism gets into our body till it leads to clinical symptoms, till it leads to symptoms, that is till I develop fever or cough or whatever pertaining to COVID, that period is called the incubation period. And incubation period for corona is said to be about from between 4 to 14 days. And that's the reason why we say you should be in quarantine for at least 14 days till you know for sure that you're not falling sick, or else you can get tested before that. It's best to consult a doctor when you've come in contact with a COVID positive patient. Now, I said, if you happen to be not feeling well, if you have any of the symptoms that we saw in the previous slide, you should consult a doctor. Okay, the doctor is going to tell you if you need to get tested for COVID. And if unfortunately you get tested for positive for COVID, see if your symptoms are mild, or you could be either asymptomatic as well. Right? And if you're asymptomatic or you have mild symptoms, then you can very well stay at home, and we call this home isolation. Okay, and you should be in constant contact with the doctor, because there are a few investigations, a few blood tests, and a few tests like chest X-ray and things that we usually ask you people to do, and we also put you on some medications that you need to be on while you are under home isolation. And there are certain things that you need to monitor, that is, you need to check in your body while you are in home isolation. All right, so when you're at home in home isolation, if you're COVID positive or anyone in your are you able to see my video, Sheila?
Right now it's black.
Yeah, it's can you see it now?
Still blank.
Okay, should I turn it off and start it again, because it just showed me it's still blank, is it?
Yes, it's a down.
Okay, I'll just go back. Are you able to see my desktop now?
No, it's just a blank screen.
Okay, I probably will stop sharing now and then start sharing once again.
That should.
Can you see my desktop now?
Yes.
Yes. Okay. Okay, so what we were talking about home isolation. So if any one of you or any member in the family turns positive and is in isolation at home, there are a few warning symptoms that we would want you to watch out for. And these warning symptoms are: one, if the person is complaining of any difficulty in breathing, or if you find that the person is breathing very fast. Second, if there is a dip in the oxygen saturation. I'll talk to you about in the next slide how to measure it and why it is important. If there is a dip in the oxygen saturation in our body, which is less than 95%, or if the person complains of a pain or pressure in the chest, if the person appears to be little confused, or if he appears to be sleeping and try as you might, you're not able to wake him or her up, if the person's speech doesn't seem very clear, if he happens to be having a seizure, or if he or she is complaining of weakness or numbness in any limb or his face, or if they seem to have bluish color lips, or if the face is appearing blue. All these are warning symptoms, in which case you must immediately take them to the hospital and get them admitted to the hospital, which it shows that they're really sick and they're not getting enough oxygen in the body, and they need to be given oxygen in the hospital, or they need to be put in a machine, they need to be connected to a machine which will help them breathe and improve the oxygen levels in their body. Okay, I spoke to you about oxygen saturation. Now, we have an entity in COVID called happy hypoxia. The word hypoxia means decreased oxygen level in the body. Anything hypo is low. Okay, so hypoxia means low oxygen levels in the body. And why do we say happy? Because usually people, when they have, in you and me, in normal people who don't have any other infections in the lung or who do not smoke, our oxygen saturation will be somewhere in the range of 98 to 100%. Right. So whenever our oxygen saturation in a normal person, if our oxygen saturation decreases for some reason, goes below 95 or whatever, we start to have symptoms. We start to feel difficulty in breathing. The symptoms that I mentioned before, right? We may get confused, we become irritated, we may have a pain in our chest, we start to breathe very fast, we may have a headache, we may start to sweat a lot. But very funnily, in patients who are COVID positive, we've had patients whose oxygen saturation have gone down from a normal of 98 to 100%. It has gone down to about 50 to 60%, and still they do not have any symptoms. They are just sitting on the bed with maybe a little bit of a cough and little difficulty in breathing, but not too much. And that's why the term happy hypoxia was used for COVID patients. And it is very important to note this. And we use an equipment called the pulse oximeter. Are you all able to see this? Are you all able to see here? Yes. So this is a pulse oximeter that I have at home. So this is a very simple device to use. Okay. So it's got a clip. I insert, my hands are very cold now because I've switched on the fan. So you might need an oxygen saturation less. Don't get worried. I'm okay. So it reads out the SpO2 values. You can see it shows 99%, which means that the oxygen levels in my body is normal, right? So this is what we use to find out the oxygen saturation level. So if you are in home isolation or any member in your family is in home isolation, it would be best if you could get a pulse oximeter. It is freely available in all medical stores. Check their oxygen saturation at least 3 times a day. All right, and if it is seen to fall less than 95%, then immediately contact a doctor and take them to the hospital. So we have seen what all we need to do a person if we happen to turn positive, and how to prevent ourselves from getting COVID. But in spite of knowing all this, we still can be scared, right? Should I be scared? Of course you can be scared. It's okay to be scared, because we don't know what we're dealing with. In spite of the fact that we've been living with this virus for the past 1 year or so, there are so many new things that we're learning about the virus. We now have people who are coming back with, who have had COVID in the past, who come back with symptoms which we call as the sequelae of COVID-19, and we are just learning, as days go by, new things about the virus. So it is very natural to be scared. Even I am scared as a doctor who works with COVID positive patients every day. I'm also scared to come back home, so don't know what we're getting back home as well, right? So it's very natural that we are scared, but you need to always remember that, it's best to stay away from what social media and minute-to-minute news channels are feeding you about COVID, right? You always remember that these news channels are interested in only sensational news. They will give you only the worst outcomes. They're not going to talk to you about the large part of the pizza. They're going to talk about the yellow part of the pizza and make it look like the largest part of the pizza. Right? But we have seen which is the largest part of the pizza. The largest part of the pizza is the good part of the pizza, right? So try staying away from social media and up-to-the-minute news about COVID. Know the facts, right? You have webinars, you have people who've worked with COVID, you've had people who've been infected with COVID and gone through it. Talk to them, know the facts, know how to deal with it, and remind yourself of reasons not to worry. Okay, do not be afraid to do activities. It's been a long time. It's very difficult to sit at home lockdown. I'm really proud of all of you kids, including my daughter. You've never complained, in spite of the fact that you've never been allowed to go out and play as much with your friends like before, but you've always all been really understanding about the situation. So do not be afraid to do activities now which have low contact. So you can probably go out and play with, one or two of your friends. Try not to go into large numbers, just one or two of your friends, or just go alone with your parents for a walk or for running, or you can play like sports which have less contact, like maybe tennis or badminton, where only just two of you are playing with the masks on. Okay, occupy. And if you happen to be COVID positive, or somebody in your family is COVID positive, and because of which you are also forced to sit at home and be in quarantine along with them, then try to engage in some relaxing hobbies. Try to understand that I'm not allowed to go out, so that I do not spread that infection to my friends and their relatives, right? And if you're feeling very, very scared, then find an adult who can talk to you. If it is in school, your class teacher, your teacher, or somebody like Sheila ma'am who can guide you, or even somebody in your family or in your community you can talk to. Find an adult who you can talk with and share your fears with, right? And other than for what all the preventive measures that we have talked about, other things that I really want you to do is eat healthy, right? I think this is a very good excuse now. The COVID has given us a very good excuse to review what we are eating, right? Try to eat a healthy meal, healthy and balanced meal with good minerals and vitamins. Sleep, another thing that is very important is to get a full night's sleep, at least a minimum of 6 to 8 hours. Okay, I have a lot of my friends who say, oh, 6 to 8 hours of sleep. Okay, I sat up watching TV till 4 o'clock in the morning, and then I slept for 3 hours till 7. Then I had to wake up because I had a call, and then I made up for that sleep. I slept another 3 hours in the afternoon. So in all over 24 hours, I slept for 7 hours. That is not what we mean by 7 hours of sleep. When we say 7 hours of sleep, we mean 7 hours of undisturbed sleep in the night, right? At night, because your body needs rest. You've been working overtime, you've been attending webinars, online classes, you've been working from home, your mind has been working all the time, or you've been working out, exercising or playing some sport. So your body needs rest, right? You need to sleep that time. If you do not sleep, the immune levels of your body come down drastically, and you're more prone to getting not only COVID, but also other diseases. Another thing is to exercise, because exercise again improves your lung capacity, right? COVID is known to cause problems in the lungs. So if you exercise regularly, you can increase your lung capacity, you can increase your breathing levels. Also, it can improve your immunity so that you are protected by your body against these infections. Another thing that I request all of you to be is understanding. You've been very understanding, yes, but like I said, quarantine. If you have come in contact with somebody who is positive, I told you that you need to be in quarantine at home for at least 1 week to 14 days, right? When you have absolutely no symptoms, sometimes it doesn't make it doesn't make sense to be sitting at home and not meeting anybody. But know that the incubation period of the virus is anywhere between 4 and 14 days, and between that period, at any point you could become positive, right? So you do not want to put your friends and their your loved ones at risk. So be understanding whenever required, whenever somebody is asking you to be at home and be away from people, understand why we are asking you to do that. And while you're forced to sit in quarantine or lockdown inside your house, engage in activities that are going to keep your mind away from all this boredom, right? Now, everyone talks about doctors and nurses and everyone being corona warriors, but I kind of beg to differ. Yes, we do, fight against COVID because that's part of my work, that's part of my job profile. But I feel that each one of us has a warrior in us, right? We all can be corona warriors if we stick to the norms that we need to do: hand hygiene, social distancing, and mask, to help and prevent infection of this virus, and somehow try to stand up together to fight this virus so that we can abolish this virus and defeat this virus and remove this virus from our country, right? So this is a slide that I want to show you because to show you that you as an audience is very, very important to me today, because I feel as students you are like big time social influencers. So I am coming here with my brand which says take steps to prevent COVID and do what is necessary to prevent the spread of this infection to your loved ones and your friends. So this is my brand. I share my brand with you, the social influencers. I want you to go back to society, change the way people think about it, educate them as to what is right, what is wrong, and let's stand up together to battle this virus. And which means no more running from the virus, and ultimately putting that mask back on that virus. Thank you so much for listening patiently. Now, if any of you have any questions, I would love to take that. I'll try my level best to answer those.
Doctor, thank you. If you could go on mute for a minute.
Yes.
Thank you, doctor. Also, you may have to stop sharing your screen now. There are some questions that students have asked us. I'm not sure if your camera is also turned off. There are some interesting questions that have come our way right now. There is a student called Jerome, and he's had a couple of questions, one of which even I had the same sort of a question. How many strains of COVID do we have right now? Doctor, we can't hear you. I think you're still on mute.
Hi, Jerome. A very good question, but unfortunately, I wouldn't be able to answer this question because, we ourselves do not know how many types of strains there. Are you able to hear me?
Yes, doctor, but we are not able to see you. So maybe if you could stop sharing your screen and turn on your camera, it would be nice for us to see you. And
my camera is turned on. Are you still seeing my screen?
I am seeing a question and answer screen. No, I think that's from the technical team, but
I'll turn off my camera and then turn it back on again. So,
okay.
Can you see me?
I can.
Yes, ma'am. Yes.
Yeah. So Jerome, hi. It's a very lovely question, Jerome, but I'm really sorry. I wouldn't be able to answer that question because we're really not sure. Like I said, we're learning new things about the virus. There's been a lot of talk about, how the strains in India is different from the strains that were infecting people in China, and how it is different from the strains available in, present in different parts of the continents, different parts of the world. But we really don't know the answer to this. So I'm afraid I won't be able to tell you how many strains right now. Also, there's been a lot of talk as to, maybe Indians have more protective benefit against corona because we've been exposed to so many diseases as we grew up. So people say that we may have a protective benefit. But again, we do not know because like when we really look at the global trends, we are tending to follow the same kind of trends. Maybe the number of deaths are a little less also because the population that is infected in our country are usually younger. So we have a little lower, number of older population than in the West. Right, so that's also probably the reason why we have, better rates or, or comparatively lower death rates perhaps. So we really don't know the answer to this. We'll just learn as we go, I feel.
Thank you. Jerome, in fact, has a couple of more questions. I'm just going to read these questions, and they're quite interesting. So one is, what is the possibility of getting COVID through the mode of aerosol droplet infection? Do we get acquired recovered from COVID? If we've been infected with COVID, do you actually acquire an immunity that lasts lifelong? And how are vitamin D and sunlight acting as factors to control the virulence of this virus?
Yeah. Anything else?
No, these are questions from
Jerome. You belong to which class, man?
Yeah, I'm also quite interested about that right now.
Yeah, I'm so glad you've been reading up so much about it. Very good questions, yes. I didn't include all of this because I didn't want it to be like a, because we are talking to a wide range of audience here from 4th standard to 10th standard. I didn't want it all to go over the head for people. So your first question was about aerosol spread. I am hoping that the slide that I showed you has helped clear the question, but if you have anything specific to ask about it, I'd be happy to talk to you about it again. The second question was whether we'll have lifelong immunity, right? So very surprising. So we have two kinds of tests that we do for COVID. Okay, so we do an antigen test or a nucleic acid test to find out if a person is COVID positive. So we find the proteins in the proteins that surround the virus, that encapsulate the virus. If those are present, we find it with the antigen or the nucleic acid test, which tells you whether the person is COVID positive or not. Okay, and the other type of test that we do is an antibody test. Okay, the antibody test doesn't really have a role in telling you if you're positive. We don't usually use it as a test for telling if the person is positive, though there is some part of it which tells me if I have the infection or not, but we don't use it routinely for knowing if a person is COVID positive. Antibody test is basically to find out if I have developed antibodies to the virus. So if I've had COVID, if I've been infected with COVID, I do a test for antibodies after a month after I've developed COVID, I've turned COVID positive, which will tell me if my body has developed sufficient antibodies to protect me from further infection from the virus. All right. So a lot of publications till now, a lot of medical articles till now have been saying that these viruses, these antibodies stay in our system for about 3 or 4 months. And so the protective benefit of these antibodies from the next viral infection is going to be only about 3 to 4 months. Okay, so for now, we do not have lifelong immunity with this virus. But I've had students who've had very high levels of antibodies after they turned positive. They after a month when they tested for antibodies, they had very good protective, antibody levels in their body. But when they tested themselves after 2 months, the antibody levels had come down to 0. Right. So even though there are publications which say that these antibody levels are present for 3 to 4 months, we still do not have a clear-cut answer as to how long these antibodies last. We have seen patients who've had antibodies for longer than 4 months. We've had patients who've had no antibodies after turning positive. I've had students who've turned COVID positive, who've been in home isolation, but when they went to test for their antibody levels, they had absolutely no antibodies, right? So it's been really funny the way each one's body has been reacting to the virus, and that is the reason why it's still a question mark, right? So there are a lot of unanswered questions still. So one thing that I can tell you is right now, from what we know, we do not have lifelong immunity from the virus, and that's the reason why we as medical professionals are also skeptical about, you know, what the vaccine is going to do, right? Usually influenza virus, so coronavirus also comes under the influenza virus groups. So influenza virus vaccines do not provide lifelong immunity. You have to take these vaccines every year, and that's the reason why you get your flu shots every year, because flu viruses are known to keep changing their strains. Right? You cannot keep track of how they keep changing their strain. So we do not know if corona has actually changed its strain right now. So if we are getting, by the time we get a vaccine, we do not know if it's actually going to act on that present strain at that point in time. So we are a little skeptical, and that's why we're all watching to see how effective the vaccine is going to be. I hope I've cleared that question. Your third question was about vitamin D and sunshine and how that is helping with the virulence of the bacteria, of the virus, sorry. So when we talk about virulence, it means how infective the virus is, or, you know, whether the sunshine helps in killing the virus. Is that what you meant? But we've seen that whether it is hot season or cold season, we're still having a virus. So it means that probably sunshine doesn't really have, you know, nothing much to do with killing the virus or making it less infective. But vitamin D and sunshine, exposure to sunshine is definitely going to increase the vitamin D levels in your body. And also taking vitamin D as supplements is something that we give our patients who are in, you know, any person who turns COVID positive, we ask them to take vitamin D supplements. How it helps is not by decreasing the virulence, but we have seen that unlike other viral infections, where the main problem is the virus that causes the, you know, in the virus causing an infection in the body leads to cough and cold and, you know, whatever. But with COVID, what is happening is, in addition to what the virus is causing, your own body's immune response, inflammatory responses in our body is causing damage to our lungs, right? So we are trying to decrease, we're not trying to decrease the immune response. So we have certain things called inflammatory markers along with our immune system is something that protects our body from any organism that attacks our body. Okay, so along with our immune cells, we also the white blood cells. I hope you know about the red blood cells and the white blood cells. So the white blood cells are the immune cells in our body. When the immune cells are fighting against the you know, organism, any organism, whether it is a virus or a bacteria, we have certain, you know, when they are fighting, there is something called inflammatory markers that are released because of that fight between the immune cells and the virus in our body. And that inflammatory mediators or markers, inflammatory substances that are released during the fight between our immune cells and the virus is causing a lot of damage in the COVID positive patients, leading to the deaths that we are seeing, right? So vitamin D, vitamin C and zinc, these three things have shown to decrease the inflammatory reactions in our body. So it brings down the inflammatory reactions in the body to decrease the damage that these inflammatory reactions cause in our body. So these three things, the vitamin D, vitamin C and zinc, has been shown to definitely decrease the you know, ill effects of the ongoing fight between our immune cells and the virus. I hope I've made it clear to you.
That was quite clear, Doctor. We do have, I'm quite pleasantly surprised by the kind of questions that are coming our way, which means I think our students are doing a lot of reading.
Very good. I'm feeling a little nervous now. Yeah.
Yeah, the other question is, can corona mutate after getting affected in our body? You know, once I'm affected with the virus, does it mutate within me? How does the mutation work?
So again, we do not know, right? Like I said, whatever we know about the virus is from all the publications that have happened. So typically when we publicize, we give something for publication, we would wait for a year or two to know what the effects of our drug. No, that's typically how a medical system works. So if I'm trying to find out what is the effect of a drug that I've found out, or if there is a new organism, what is the effect, or if there is a new vaccine, what is the effect of that vaccine, I typically wait for more than a year or two to wait and see what the side effects are, what is the effect of that virus, or what is the effect of that organism or the medicine that I have found out, and then I give it for I send it for publications. But now, since we are in a pandemic, everyone is trying to find out more about the virus. Everyone is trying to find out a treatment for the virus so that we can somehow get rid of it. So everything is being speeded up, including the vaccine that we are making, right? So we really do not know what the virus is doing, okay, inside our body. We have not really I know that there are a lot of publications and articles, newspaper articles, a lot of media information about how new strains are coming, how a mutated form is coming, but we really do not have a clear-cut picture as to what is happening inside our body after the virus is infecting us. But a very disturbing thing that we have seen is that there are people who are getting reinfected with the virus. There are people who have had the virus, who've been typically asymptomatic. Okay, when we talked about the very happy large slice of pizza, the older people who've been lucky enough to be in that large slice of pizza, who've had absolutely no symptoms during the time they were in isolation, have been cleared by a doctor to get discharged from the hospital if they were admitted in the hospital, but they unfortunately come back to us after even after a month with symptoms like breathing difficulty or not being able to walk for a long distance. I've had a colleague recently who 3 weeks after being infected had seizures, right? So we're really trying, we still don't know what is happening. We're still on the learn, so we really don't know for sure what is happening to the body, how is this virus going to treat your body, how is it, even if you've been lucky enough to be asymptomatic, is it going to really affect something long term? We have to wait and watch.
This virus sounds quite crazy and scary.
It is.
So I have a very question, that came up to my head. While COVID kind of began, when the virus started making news, there was also people talking about the Spanish flu virus. And when we did read up on the Spanish flu virus, what I remember reading is the virus kind of weakened and they didn't even need to find a vaccine for it, and it kind of vanished. So is that how COVID is going to be, or will there be a vaccine? There are a couple of students who've asked me that question. If Covaxin and if we will need to get a vaccine,
Yes, so if we don't even have to go as far as the Spanish flu. If you remember, in the year 2009, that was the time I was pregnant with my daughter, we had an infection called H1N1.
Yes.
Right? Yeah. That was not exactly a pandemic, but it also had the potential to turn out to be a pandemic, right? Because it was also causing a lot of deaths. A lot of countries were also infected at that point in time. Right, it had the potential, but at some point, it kind of, I think probably we got immune to it at some point, or we again, for even H1N1, we did have Tamiflu. We had a few antivirals which really worked for H1N1. Unfortunately for COVID, the antivirals are all not working equally for all patients, right? It does work. Some of the antivirals that we use work for some patients. For some patients, it doesn't work at all, right? So we've unfortunately not had a antiviral also that really helps with COVID. So I can just say that we can hope that we develop immunity. Right, I can hope that we get a virus soon enough before the viral strain changes, and I hope we get some sort of immunity, because see, from whatever any vaccine that we get is going to behave the same way like getting infected with COVID, right? So I told you that I've had people who've been infected with COVID but didn't develop antibodies, right?
Yeah.
Who've been infected with COVID, developed high levels of antibodies, they vanished in 2 months' time. Have developed antibodies which has lasted for about 3 to 4 months. So the same thing could happen with the vaccine as well. And that's the reason why I said, while everyone around me gets excited about the vaccine, I still look at it with a little bit of, I'm a little skeptical about whether it's going to really work. And that's the reason why we say, I just know one answer, right? Can we prevent it? Can we do something about it? Yes. We can do, hand washing, we can do the mask, we can do social distancing. This is something that I can tell you for sure works, right? Because I worked in a COVID, ICU. I worked with the most severely ill patients, working with them on ventilators, talking to them, wearing my PPE. So tomorrow, probably when I'm talking to your parents, I might put up a few, pictures of us in the PPE suits. I didn't want to scare you all with those pictures. So I have worked with these patients and I've come in contact with COVID positive colleagues, but we've used protection. We've used N95 masks. We've been careful about washing our hands, and so far, touch wood, we've been safe, but I don't know. Again, like I said, in spite of our best efforts, there is a possibility that we might still get it. But this is something that I know that, like a mantra, that I know that it should work.
Yeah. So masks and gloves. I don't know if gloves work,
Gloves
but masks.
is something that I would, I didn't include in the talk today, but I do have a slide for tomorrow's talk. Glove is something that I would try and avoid wearing because it kind of gives a false sense of protection, right? You feel that you're wearing gloves and so you're fine, but then you tend to touch everywhere. Whereas when you touch things with your hand, your hands are dirty and you know that you need to, wash your hands. But having said that, it's not wrong to use gloves if you want to use gloves. Like I know of friends who go to the supermarket to pick up things, who prefer to use gloves. It's okay. If you want to go, when you get out of your car, wear a pair of gloves, pick up everything from the supermarket. When you're leaving the supermarket, dispose your gloves, throw it away and get into your car. So that is fine. You may want to use gloves when you're washing, vessels or utensils of people in your house who are COVID positive, right? So that you protect yourself from infection. You may want to use gloves when you are taking care of somebody in the house who's COVID positive, who's elderly and who needs to be taken care of, or if there are young children who need to be taken care of, you can still wear gloves. But if you're wearing gloves, use it only for the activity that you're wearing it for and remove it immediately and discard it in a safe place, and don't let it remain lying around for small kids to come and play with it and lick it and then get infected through that, right? So we know how the younger ones and the naughty ones at home can be, right?
So that is also an information I think we as a general population need to kind of pass on, because I have seen people wearing the same gloves over and over again,
yes.
For the entire day, and it's actually, I think, infections kind of get worse, kind of spreads.
Another very dangerous pictures of celebrities, Bollywood celebrities who come out of their cars wearing gloves. Whenever I see that, I always feel that sends out a wrong picture, right? So I'm not telling you that using gloves is you shouldn't use gloves at all. Like I said, if there are certain circumstances when you go pick up vegetables, or you go to buy books, or you go to buy something off the store, if you feel like wearing gloves, you can wear your gloves. There's no harm in wearing your gloves, but make sure you discard those gloves in a safe place. And then you still need to wash your hands after your gloves. Wearing gloves inside the shop doesn't protect, because when you're removing the gloves, if you're not used to wearing, we as medical professionals, we know how to remove the gloves without infecting our hands beneath the gloves. But when we're not used to using gloves, we don't know how to remove them without infecting the rest of our hands, right? So after you've used your gloves, also you need to wash your hands.
A few more questions, and some of them are, very simple, I would probably call them as.
That's okay, no problem.
Can weather be an important, play an important role in transferring the virus from one person to the other? And also, animals, do they carry COVID-19?
What was the first question? Can you tell me that again?
Climate, the weather changes.
Yeah.
The climatic conditions, do they play a role in transferring the virus from one person to the other?
Yeah. So a lot of studies by groups who have been trying to plot graphs to see whether we're going to have a second wave, and things have shown that you'll have a second wave when winter sets in. So this might have a role because in winter, typically what happens is your immune levels fall down because it's very cold. That is where, a lot of people get infected with a flu virus and things. So COVID may also behave in that way. And that's the reason why I really jumped at the opportunity to talk today, because we, in the hospital now are seeing a little decrease in the numbers of patients, right? We don't want to be, jump and be happy and excited saying that, oh, the numbers are decreasing, because we don't know yet, but we definitely are seeing a decrease in numbers. And when the rest of the world is going into a second wave, I am hoping that we can try our level best to not get into that second wave, because I do not think economically we'll do good, with a lockdown, right? Even mentally, I don't think we'll all do good with a lockdown. So, I really wish, because I step out now and I see everyone's trying to get back to a normal life. The traffic in Bangalore has come back to the normal Bangalore traffic. So I do not judge people for doing that. All I'm asking is, if you're going out, please wear a mask, please keep away, please avoid going to crowded places, please wash your hands, please do not touch your face. And if you are not feeling well, if you feel you have fever or cold or cough, please stay at home till you figure out what you're having. Yeah. Right? Because the weather is really bad, a lot of people are falling sick. Okay, so you might have fever and cold because of some other virus, and there's also a lot of dengue happening around, so you may have some other viral infections as well. But unless you know what you have, I really literally beg of you to please sit at home till we figure out what you have, and then we can go out and things like that.
Yeah. What about the animals, doctor? Do they also?
Animals, again, we though initial reports said that we got infected from the live animal market in Wuhan, and bats were known to be the carriers of the virus. That is something which is still not clear, but we really haven't seen animal cases, much of animal cases. There are not a lot of animal cases that have been reported, so can't really comment on what it is. We probably have to wait for another year to see what the virus actually does.
Yeah. And the masks, you did mention about the N95.
Yeah, but the kinds of masks.
Yeah. But also, I think there has been a ban with the general population using N95 masks. So one of the question here is, what kind of masks are good during the pandemic, are safer for us to use during this pandemic?
I had all these, I have all these slides up for the adults, thinking these are the questions that the adults are going to ask me, but I am so happy that all of you are asking me these questions. So it's true that we do not ask you to wear N95 masks on a regular basis, right? For normal use, when you probably at home, when your maid comes in, or when you're just walking out in your apartment, or you're outside your house on a road which is not too crowded, you can use a cloth mask, right? But if you're stepping out in a public place where that there could be a lot of people who are infected with the virus, then it is safer to use a surgical mask. We call it a 3-ply mask, the blue color mask with those layers which you tie up. So it is better to use a surgical mask, all right? And but however, if I were to go to the hospital, especially to a hospital which has COVID positive patients, then I would tend to wear an N95 mask, because there I know that I'm going in the midst of people who are constantly being exposed to COVID-19, and there's a high risk of me getting that infection from that place. Then I would use an N95 mask, and I also would use an N95 mask if I'm COVID positive and I'm in home isolation. When I come in contact with my family members, I would definitely wear an N95 mask, because that is the only mask that prevents the virus is from I won't say like N95 means that 95% is filtered, right? So it prevents at least 95% of the viruses that come out through my mouth from getting out into the atmosphere.
No.
But definitely not the sponge masks, which
Yeah.
the fancy sponge masks. No, I wouldn't wear them. Okay.
Yeah.
So yeah, because they have absolutely no protection against dust. They have no protection against bacteria. They have no protection against the virus. So they're not going to help you with anything, right?
Yeah. Yeah. Okay. Thank you for that, doctor. One last question. I know we've kind of overshot our
No,
time.
that's okay. No problem. I'm glad to answer any questions.
Yeah.
Yes.
So generally, the COVID patients get prescribed with EFV. That is what one of the student has.
You have to tell me what EFV is.
EFVC 1000 vitamin C tablet. A patient who is diagnosed with COVID.
Okay. So it must be like an effervescent vitamin C tablet. Okay.
And he says, he asks if other family members can also take this as a preventive measure.
Yeah. So we do prescribe 1000 milligrams of vitamin C for patients who are severely infected with COVID in our ICUs. But if you were to take anything more than 500 milligram per day on a regular basis, you definitely tend to have some GI related issues. Okay, so I was one of them. I took 1000 milligrams of vitamin C just before I got into my COVID postings because I thought I wanted to take some, additional protection, get my immune system up before I get into COVID. And the whole of those 2 weeks, I had loose stools. And I didn't know if it was because of COVID or because it was because of vitamin C. So I would suggest that we do not go up to 1000 milligrams, and I'm not going to give you a dose as such. So anybody who's COVID positive, I would want you to, consult with a doctor, and they will prescribe a medicine. However, if you want to have vitamin C as a supplement in your house, so try not to go above 500 milligram per day. Again, the dose for kids is going to be different. So from maybe 6 standard above, I probably give 500 milligram per day. But less than that, I would want you to speak to a doctor and do this. Again, if you are vitamin D, vitamin C, any of the vitamins and minerals, when you take supplements for a long time, you always need to give a break to your body from. So don't take any of these vitamins unprescribed. Talk to a doctor regarding it. So even when I'm taking these vitamins, I take a break of at least a month, so that I'm not overwhelming my kidneys, because kidneys are the organs that, metabolize all these drugs. So I do not want to overburden my kidneys and end up with a kidney problem because I'm trying to, protect myself from COVID, which I may not get infected at all, right? We don't know. So let's not do any prescriptions by ourselves. Okay, so whenever you think you want to take any medicine, I would suggest you talk to a doctor, right? Yeah, so that's what I have to say about it.
Few more questions. One or two more. Can I take those?
Sure, no problem.
So younger generation do develop better immune system to respond to the virus if they are lightly exposed to the virus slowly. Maybe the question is, do younger generation kind of develop better immunity?
Yeah, so like I said, we've had all pediatric is all kids. Okay, so all pediatric patients that we've had have been fortunately mildly symptomatic or asymptomatic and have been, have not really had too much of a problem. But there have been a few, publications or papers and what people have reported that they've seen a few effects of COVID in kids as well. But, I do not want to even go there now because these are just what a few people are talking about. We do not know whether this was because of COVID or whether, this is something that was probably because of some other disease the child had. So we really do not know, like with most of the questions that I have answered today, we really don't know, right, what is happening. We'll have to really wait and watch what are the long-term effects of this virus.
Just your opinion on this, Doctor. A couple of students have asked me this. Now there's a lot of talk about schools having to reopen. The question is, isn't this, not the right time for schools to reopen? It's not safe. So what would your opinion be on that?
Now, this is completely my personal opinion, okay? This cannot be taken as a mantra, and I feel there are better people to sit down and talk about it with the education, system and the school managements and things to take a better decision. But if I were to be asked by the school management of my daughter, what I think about it, I would say that I want to wait and watch for some more time to see if we are entering a second wave.
Yeah.
Right? Because like I said, we are somehow seeing that the number of cases are either decreasing or there may be, so we don't know whether the cases in the hospitals are decreasing because most of the patients who are positive are asymptomatic and in isolation at home. So we don't know those numbers as yet. Right? I wouldn't just look at the numbers in the hospitals and say that, oh, the numbers in the hospitals are decreasing, so the number of cases are decreasing, because we don't know what's happening with the people who are at home in isolation. We don't know how many people are in isolation, right? We don't have the real numbers. So we really don't know whether we are coming down on the numbers or whether we are still in our first wave. Like I was just talking to a friend of mine who's an anesthesiologist in Canada, and they were like, we're in the second wave, and I'm like, I don't even know whether our first wave is over, right? So we don't know whether we are finished with our first wave. We don't know if we're seeing a decreasing trend. At a time when I'm beginning to see a decreasing trend, if I were to start the schools, am I going to increase the number of cases and cause a second wave? So I, as a parent, would want to wait for a bit. But like I said, because I'm saying that we cannot take that as a a rule or whatever. So there are probably better people to take that kind of decision.
I think we'll probably call it a day. There are a few more questions.
No, that's okay. If time permits for you, then
maybe just another two more. One of my questions that I wanted to ask is, WHO had put out a news or an alert saying that there are going to be many more pandemics that we would be seeing in the near future. I just wanted to know what you think about that. Is that true? Is that something?
So like I said, right, we've actually had our share of, prospective pandemics that somehow didn't turn out to be pandemics. Like we had the H1N1, and then we at some point had a plague also, I think, right? Like somewhere in the late 90s, we did have an outbreak of plague, right? So we've had our, share of prospective pandemics. Somehow, fortunately, they didn't turn out to be pandemics. If we really read from history, there have been pandemics, so we can't say that we won't have a pandemic again, right? Another pandemic that we have and we really don't talk too much about is HIV, right? That was a pandemic, and it still is, and it's just become a part of our it's just become a part of our lives now, and we have good drugs against it. And that again, a lot of preventive measures helped in controlling that pandemic, right? When we talked about transmission of HIV, so a preventive measures really played a big role in controlling that pandemic as well. So yes, I think we may have pandemics, but I don't know. I'm not really sure about the number of pandemics or how soon we're going to get the next pandemic. But then, yeah, I don't think we can be safe from that. As long as there are organisms around us, I think they'll keep trying to attack us.
All right. One last question, Doctor. Can COVID cause problems to a woman's pregnancy and the baby?
This is another, this is something, again, we don't know too much about, right? So from what we know, from what we've seen right now, pregnant women who've been positive, who were COVID positive during their pregnancy or have, were COVID positive at the time of their delivery, not all babies were COVID positive, right? So we've had babies who didn't have COVID infection when they were born, in spite of being born to mothers who were COVID positive. But we'll have to wait for them to grow up to see whether there's any sequelae, right? So that's That's something we don't know about.
Yeah.
About future pregnancies, whether there's going to be any problem with the women who turned out to be COVID positive during their present pregnancies, if this is going to affect their future pregnancies. Again, we're going to know that only with time.
Right.
So like I said, a lot of things that we're discussing today, right? We're talking about vitamin D, C, zinc, and we're talking about all these vaccines, we're talking about all these antiviral medications. These are all things that we know from whatever we have experienced until today, right? Tomorrow, things might change. So tomorrow, whatever I say might change. But again, coming back to my preventive measures, the only things that will not change with time is the preventive measures, right?
Yeah.
The mask and the hand washing and the social distancing. These three things will not change because we know that this is how the virus is being spread.
Right. So that's about it. We've taken most of the questions that the students have asked. Thank you for patiently answering those questions and addressing us and making us aware of what the coronavirus is all about. This is something I would like to tell our students. We are going to have another session for your parents tomorrow as well by Dr. Gayatri. You are most welcome to attend the session with your parents, but do remind your parents and do let them know that it is a compulsory session for them to attend. It would be from 4 o'clock. We will start around 4 and hopefully wind up by 5:30. Do inform your parents. So Dr. Gayatri, thank you so much for taking our invite and being so readily accepting the invite in the first place. I'd like to invite Miss Rani to do the vote of thanks for today.
I just want to put in just one word. I'm really thankful for everyone at St. Joseph's, and I'm really proud of having such a brilliant audience today. I feel so sorry that I removed a lot of slides thinking that this may not interest you, but I'm so sorry that I undermined all of you, and I'm glad you came out with such interesting questions, and it was really interesting discussing this with you. And once again, I just so wish that I could see you people and interact live with you rather than looking at myself when I'm answering these questions.
We will definitely have another session once schools reopen. I would definitely would like you to come over and meet us.
I love that. Yeah, yeah, sure.
Thank you so much, Doctor.
Thank you.
Over to Ms. Rani.
Gratitude is the healthiest of all human emotions. I, on behalf of St. Joseph's School CBSE, extend our heartfelt gratitude to Dr. Gayatri Shashi Kumar for graciously accepting our invitation to conduct today's session. It is indeed an educative and weighty enlightening session. Thank you, Dr. Gayatri Shashi Kumar, for sharing your knowledge with us. We are very grateful to our principal, Father Rohan, for organizing this meaningful session. And I thank the moderator, Ms. Sheila, and the technical support team, Ms. Rani, Ms. Yashaswini, and Ms. Akshata. Profound thanks to you, students, for your active involvement in this session and making it a successful one. Thank you, and have a wonderful day.
Dear students, we've come to the end of the session. You may exit the webinar right now. Thank you so much for being so attentive and interactive as well. Thank you.